There have been proposed changes to the vaccine recommendations for our kids and for COVID that are awaiting final CDC approval. And there's a lot of confusion around it all. So joining us to make sense of it all is ABC News medical correspondent Dr. Darien Sutton. Good morning. It is good to see you.
Good to see all of you too.
Let's start with the vaccine schedule for children. This is something that parents are always watching. What has changed?
So a lot has gone on in the past week with the CDC Advisory Committee. Much confusion, not only from the public perspective, but within the committee themselves. Where it stands is that the evidence has not changed, but vaccine access has narrowed. So starting with the MMRV vaccine, this stands for measles, mumps, rubella, and varicella. That's the virus that causes chickenpox. Many at home, younger generations might not remember that infection because of this vaccine. What's important to understand is that it was offered previously in two options. Parents could either do two separate doses, MMR and V, or they could do a combined dosage. We've known for nearly 20 years that the combined dosage comes with a rare but important to acknowledge risk of something called febrile seizures. These are seizures that happen in the setting of a fever. I treat them often because the most common cause is infection. What we know now is that the MMRV combined option will no longer be available to parents, and that brings it to an option which is two shots. Of course, this is creating confusion because the evidence has been standing for nearly 20 years, and there are some options that might want to choose to do the combined dosage, mainly for convenience, but also maybe because they don't want more than one shot in that moment.
All right, parents will keep watching that for that news on that. But let's talk about the COVID vaccine because there are some changes to those recommendations. What are they? So
the COVID-19 vaccine is no longer universally recommended, but people can still get it based off of their individual decisions. Now, what that means is that insurance might be compromised. Insurance typically has to follow the recommendations of the CDC, but now that it's no longer recommended, that might compromise for insurance and also might affect access in states depending on where you are. Important to understand, private insurers have pledged to keep the coverage of COVID-19 vaccines, mainly because of a cost benefit. COVID-19 vaccines reduce the risk of hospitalizations, which are incredibly expensive. So it's important to check with your pharmacist, check with your primary care provider, and check with your state to understand your access.
Thank you for walking us through this. I mean, so many parents especially confused by some of these changes and these recommendations, so we appreciate it, Doctor, as always.